this call to order anyway, which is, you know,
Okay.
I should have changed that to Michael, but.
Okay. Then I will call the meeting to order if you want. At 4:41. We are having this meeting with remote attendance pursuant to State Executive Order 2020-07 and 2020-18. I'm not going to read, it's in the agenda, so I'll just leave that. Can I have an approval of the agenda?
I've got it up. I'll make the motion to approve the agenda as presented.
Second.
Oh yeah. All right, and then all in favor?
Aye.
All right, I guess I too. All right, and then we need an approval of the minutes. Were there any changes from the March or
Additions, corrections, and I didn't see anything from what I read. So I'll make a motion to accept the minutes as presented.
Second.
all in favor?
Aye.
Aye.
I can't figure out how to get you guys on speaker.
Did you say aye?
I don't know if this is a correction or not. I actually just noticed it. Is it too late for us to go back to the minutes? Make a minor correction.
What's the correction?
Okay, never mind. It looks different on my copy than the one on the screen. So it's right on my copy. So never mind.
All right. Rick, we'll move on to public comments. Are there any public comments?
No, there were none submitted.
Okay. All right, and then we'll move on to old business, equity, diversity, and inclusion.
Well, we formed the committee for this back in late February, and Robert Edwards is going to be the chair of this committee. And we had signed Robert up for diversity training, 3 days in Springfield, and you know what happened. COVID happened, that got canceled. So everything got put on hold for a while, but we've been talking about this issue this week quite a bit. And I believe Robert's working on this now to get started with some a meeting with that committee electronically, if I understand correctly. Is that right, Robert?
That's correct. I have a draft right now that I'll send out today, and I think Donna was on the sort of the ad hoc person before, and so I'll CC Samantha on that also when I send it out. So it's just a draft to call attention to the diversity committee again, and also to let everyone know that, you know, we're living in serious times, and kind of you know, the things that have been going on very serious, and we take our it's just sort of a heads up to realize that even the small things are important as we go forward with the library mission, and they affect you know, even the simplest thing can affect people, and definitely our services should be for everyone, and we should have, you know, people come in and they'll look for diversity. They look for I've had questions of, you know, why isn't this like this? So I also like to be able to answer those questions with, you know, this is what we're doing to make things right, if you will, if that's the right word, I'm not sure. Or we're doing to make it, you know, more diverse, to get more opinions and things like that. So it's been, as Rick said, it's been a very emotional type week. He gave a talk this morning. When he talked to the staff, he probably won't say much about that, but I will say that it was very well said, talking about how we should think as we go forward, and how this is a very real issue, very real, these are very real circumstances. And so I feel good. I feel really good about being a part of this committee, and I'm looking forward to it. And I've talked to different staff, and they're excited about, you know, the opportunity for this committee.
That's great.
Yeah. Awesome. Thank you for doing that.
Yes, thank you. Is there anything else anybody has on that? All right. And then we will move on to old business, which is public relations and marketing plan discussion.
Yeah, I put this on here because I know that we've been talking about this a lot. I wanted to let you guys know that for the time being, I want to see, we just purchased a new piece of software called Patron Point. Samantha's seen the demo. It can really do a lot of things for us marketing wise, very targeted marketing. And I want us to, we're getting trained on it right now. I want us to see how this works and see what kind of impact it has before we, before we hire somebody or completely rework our plan. I think this is the first step. So what I'm asking the committee to do is give us a couple of months to get this in order and see how it works, essentially.
It's a really cool tool. So I'm excited to see what it can do. I mean, even just for my personal usage of the library, I'm curious how it's gonna, because it looks really professional. The guy was really, like the demo that I listened to, it's very knowledgeable. It sounds like it's personalized as well to our library. Yes. So it's not
yes.
just.
And we've worked with him before when he worked with another company, and he's steered us right. So.
Okay. Well, that is good to know. Does anybody else have anything on that? All right, and then, sorry?
No, go ahead. Go.
Okay, then we'll move on to the strategic plan.
And on this, what I'm asking the committee to do, we put a lot of time in on looking at the strategic plan, but I think the entire landscape has shifted a lot. And what I am asking the committee to do is table this issue for at least a few months. I want to see, I just want us to focus on being responsive to community needs. I think the ground has shifted under us to such a degree that we need to see what our community wants. And we may want to even consider going back to the strategic planning process. And Samantha, I'd like to have a conversation with you at some point about a document you sent me about an inclusion plan that might kind of help us in a couple of areas. So yeah. I'm hoping that the committee agrees that this isn't the time to finalize a strategic plan. I think that there's a lot for us to learn in the few months about what our community is going to need as we move forward.
I would agree. Yeah.
So, yeah, there's no action there, correct?
Correct.
Right.
That's all. I was just hoping that we would all agree to take a wait and see approach for the next couple of months, at least on that issue.
Yep. I'm in agreement.
Yeah, I'd like to see. I mean, I'm interested to see what happens and what we can, like you said, like what we can learn from the next few months. Hopefully things will change a little bit. So then we'll move on to the next topic, which is drug and alcohol-free workplace policy.
And again, this one I'm going to recommend Samantha, if I can, on the next two items, actually, because they are sort of together. That one one of the pieces that the committee, I made some language changes per the committee's request, but one of the things that the committee wanted me to do was to get this to the attorney for vetting. Again, right before the whole COVID outbreak, and I did not get this to Chris until last week, and he hasn't given us his opinion on it yet. So I'm asking that this is an action item. I'm asking for a formal table until next month.
Okay, I will take a motion for tabling both items 4 and 5 of the agenda.
So moved.
Second.
Thank you. All in favor?
Aye.
Aye.
Aye. All right. Is there any other old business?
I don't have any.
All right, then we'll move on to new business. We've got did we get a FOIA report?
No, there were no FOIAs. That's the report. But also, I did want to mention it. And I believe that I shared it with you guys. The PAC did rule against the library's determination of including DPL Watchdogs and Mr. Mark Berthler as one and the same entity for the purpose of determining recurrent requester status. This is a non-binding opinion, and it comes with no penalties. While it's non-binding, we intend to abide by it.
Okay. All right, and is there a personnel update?
Simply this, that when we last met, we were looking at setting up interviews for a couple of halftime positions. Well, we put that on hold, and I'm not ready to proceed with any hiring at this point either.
Okay.
No.
All right, so we'll move on to number 3, curbside. So how is that going?
Yeah, I just wanted to let you guys, give you guys an update. We started our kind of soft open curbside service Monday and Wednesday. Monday we had all the division heads and a few librarians providing the service. We also had clerks and pages doing setup work, prep work for it. Went really smoothly. We had a couple of hiccups at the beginning, but nothing major. And on Wednesday, we decided we could serve more people per hour and do it with fewer staff. So we did that. We scheduled, instead of 10 per half hour, we opened up to 15 per half hour, and we did it with just the division heads. Tomorrow, we plan to provide the service with only 3 of us at a time. So we're going to see how that works. And Monday, we'll do one more day management. And then Tuesday, we're going to meet and talk about the handoff to the circulation department and let them take over that service from here on out. But it's gone really smoothly. We haven't been overwhelmed yet, but we'll see how it takes off next week. We did it in a pretty controlled way this first week, and people have been really, really happy. Got some really happy patrons.
Is this something that we see? I mean, I know it's too early probably to say, but that this could go on in perpetuity?
Yep. Yeah, I don't think it is too early to say, Michael. I think it will. It's just how big is it going to be? We were talking about it before COVID ever happened.
Yeah.
So it just kind of forced us to take action, and I expect it will last. What we don't know is how big will it be, so this can change a lot of things, staffing needs, space needs, workflows. So, but we do have an app that we're working on that should make the whole process even easier for patrons who use it. But I don't see it as something that is going to go away.
Good. I like it.
Yeah, we like it too. It's fun to do. You know, we'll see how fun it is in the rain or something like that. But you know, and I think it's a good service. And I believe even when we open the doors, there's going to be people who will prefer the curbside.
Well, and when it's snowing and raining, I mean, you may have to have some policy when available. You know, it may not always be available.
Yeah, and there some libraries have taken that route. Right now, what I did was I bought some umbrellas, and we'll see if we can do it. You know,
Right.
if it becomes something that we can't do without, you know, endangering staff. I mean, if there's lightning or something like that, you know, we'll definitely apply some common sense to it, or endangering our materials. But you know, we're going to try, even if it's, you know, even if it's raining, we're going to try. We had the umbrellas out Wednesday because we started to sprinkle, but it never picked up.
Well, cool.
So do we have a date when book deliveries from other libraries will start?
It's tentative, but yes, first week of July.
Okay. All right. So is there any other discussion on curbside?
Nope.
All right, we'll move on to opening date target.
So this continues to be an area where, you know, no two libraries or communities seem to agree on. It's not even about necessarily the level of the COVID outbreak in their communities. It's about their interpretation of the governor's orders. But I talked with Greg McCormick, who's the director of the state library, and he told me last week, he told me that our interpretation is what they're understanding from their conversations with the governor's office. It's the same as theirs. The state library, in fact, opened on Monday, full service, everything. I don't think we're ready for that, because what we're looking at is sort of following the retail guidelines, at least as closely as we can, because that seems to be the best analogy. And I just wanted you guys to see what we were looking at. So June 16 is my target. I mean, it's possible we'll have to push it back if we don't have every duck in a row, but we're on our way to getting that done. The first week, I just wanted to be a couple of days and some limited hours, because, you know, we're still getting down the curbside, so I didn't want to be doing both at the same time. We don't know exactly how open to the public is going to look the first days. I've got the limited hours for a couple of reasons. I want to have some space before we open and after we close, or a lot of space before we open, for our shelving staff to be able to get in and shelve without having interaction with patrons. We've got the plexiglass that we've all seen for service points at checkout and reference and computer help desk. But, you know, a shelver can't carry one of those around with them. So time being, I want to have some time for them to come in and do that without having to have that face-to-face interaction with patients.
That makes sense.
I want to expand those hours though each week until we're open our regular hours. That could happen quickly, or that could happen slowly, depending on, you know, the situation, the health situation here in Macon County, and also some other things, staffing, patron demand, but mostly it's the public health considerations. Somebody said something in chat. Let me stop sharing and see what that is. Oh, that's to me privately. Yeah, and we'll get to this in the plan, but we do quarantine the materials also. The materials that have been returned sit for 3 days, for 72 hours before anybody touches them.
Nice.
We think that that goes kind of beyond, but I can tell you that some libraries are doing a week. So the retail guidelines under phase 3 of Governor Pritzker's plan, the retail guidelines say for returns, so retail establishments get things returned also, and they are recommending 72 hours. I'm open to, if the science dictates making that longer, but for now we're going to stick with the 3 days. So here's some things that need to happen before we can open. We got to get all our signage posted. DCEO is the Department of Commerce and Economic Opportunity. Adequate, we've got the posters, we just need to get it posted. Adequate supplies of PPEs available. I think we're good on that. Staff training on the basics of COVID-19 as per Restore Illinois guidelines. I sent out a training document. Most of the staff has looked at it, but I got confirmation today from Macon County Health Department that they will be able to provide us a Zoom training. So hopefully we'll be able to do that next week. Develop protocols for those staff who have come in contact with a confirmed case. And that's something I'm working with Macon County Health on also. Develop, and this is something that we're going to talk about here in a minute, sick leave policies or agree to suspend the disincentives to using sick time. So we'll get to that in a minute. Consider temporary travel policies, which I'll also put in front of you. We will shut off water fountains to the public, at least until we move to phase 4. We've already put the arrows down on the floor to make browsing aisles one way, and we mark off 6 feet, like 6 feet in front of where I'm sitting, there is a yellow tape on the line. And that means if you're going to cross that, you need to let me know, because we both need to have the mask on if that's the case. Some other considerations, screenings, and DCO has a tool for that, but it's how do we provide it? How do we do it? Are we going to have staff sitting at the door every morning? I don't know that there's another way, but maybe we can do a self-screening. Let's give everybody this screening toolkit. That's what you do every day before you come to work. We're already doing the quarantining. We do have staff in the building requiring masks of all staff. What's not happening right now is vendors and contractors. They're not my contractors. Okay, they're the city of Decatur contractors, so I'll be having that conversation with the city. But they should be gone before we open up anyway. But you know, if you're sitting at your desk, you don't have to have your mask on. But when you get up and move about the building, you have to have your mask on. Sanitize frequently touched surfaces a minimum of every 2 hours. We've got a plan for that. Provide sanitizer for patrons using touch screens or keyboards. Actively encourage sick employees and patrons to stay home. Actively encourage proper hygiene. Capacity limits is where there's still some disagreement on, and I will forward you guys the Macon County Health Department's thoughts about this. But this is based, 305 is based on retail for phase 3. We've already worked out staggering shifts, and we'll do it in clusters of teams to reduce the risk of cross-team contagion. Sanitize baskets, shopping baskets, and mark carts after each use. We've got our building manager is looking at the air turnover rate. We're just about done with the HVAC work. I can tell you it's still plenty hot in here, but the building's beginning to cool off. We will need to keep a log of all staff, vendors, and contractors entering the building. And Macon County Health emailed me today. They would like us to get phone numbers also on there if possible, in case they have to do contact tracing. Continue to have staff who can work from home do so. So we're thinking, you know, librarians for sure in most cases can, but you know, we might have to bring them in for some desks here and there. Set a limit of 5 staff in break room at a time and a limit of 1 staff per table. No eating together, in other words. Discontinue all in-person staff meetings of over 10. Eliminate all non-essential staff travel, which is essentially all travel except, coming to work. And here's one with that, I'm hoping that the board can give us guidance on. I know that some places are just posting a sign that says, we need you to wear masks. Other places are saying, this is hard and fast rule. You will be asked to leave if you're not wearing a mask. Other places are just putting up the sign and hoping for the best. I know in my talk with the state library, and as Robert has pointed out, they have armed guards there. They are not enforcing it. They are simply recommending it. And Ngozi, you had a comment?
Yeah, I was just going to say that sometimes things like this are really hard to police, and I would not be comfortable with armed guards in any way associated with.
No. But even I think the point of mentioning armed guards is that the state library has those. I mean, you have to empty your pockets before you walk in there. And yet they are choosing to not try to enforce the patrons wearing masks. They're only enforcing their own staff doing it.
Yeah, just in case that, that came up, I just wanted to give my opinion. I mean, I get that I won't be here long, so it may not matter what I think, but armed guards or not, it's really hard to police this. And I do think, though, that we should take a stance that we want people to wear masks, but I guess maybe just know within ourselves that if someone doesn't wear the mask, do we say something to them, but know that, unless they're coughing or what have you, they don't get kicked out. It's hard to do, and I would hate for there to be an altercation. I keep thinking about the Dollar General issue where the security guard got murdered because he asked someone to wear a mask and they got mad and came back and harmed her. So I don't want to put any of our workers into having altercations with someone.
And I mean, most stores have signs up that request people to wear masks. The grocery stores, I don't think we would be any different. Every store I've been into has a sign that says that, by, the governor's order, please wear a mask. I don't know what the text is, but I mean, I agree with Ngozi. I would feel uncomfortable with, confronting someone if they didn't have a mask. But I think the sentiment, of having a sign up requesting to wear a mask, I'd be curious what retail stores are doing.
Well, I'll tell you what they're doing because I've been to most of them. Kroger is making you, if they see you, they'll come up and ask you. And Target, Walmart are not approaching. I know people that work there. They have the signs up, but they're not enforcing it. As long as people are staying within 6 feet and not, being obnoxious. Menards, I know, is enforcing it you can't come into the store. They've got somebody there saying you have to put it on. So I think you put the sign up. I would hope to think that most would wear masks. But I think the library people are far enough away from each other, I think, that even if they didn't choose to wear a mask, I think we might be okay.
Right.
I'm with Ngozi, I'm with Samantha. You don't want to have somebody chasing you around the library.
Yeah, no bouncers.
Yeah.
And everybody has enough to do anyway than to police people's mask wearing.
And that's the push. That's the push. Kind of the push and pull discussion we're having internally. So I appreciate your guidance on how we should go.
We also.
I have one more thing.
Yeah, I do too. After Ngozi.
I have two more things. So.
Okay. So I'm wondering also, will we provide some basic masks there? Because you know, there's a population that comes in that lives in poverty that may not have access to go shopping and replenish these kinds of things, or their masks may be so damaged and used that it's, you know, just maybe just thinking about it, can we have something to provide for people in case they can't get access to them, whether it's money or some other reason? Can we just have some on hand?
Yeah, and I think in our internal discussions, we think that's probably, you know, if we're going to ask people to wear them, we need to have something ready in case. And maybe you just forgot, you know. I think it's probably indicated, and the availability seems to have improved quite a bit too.
Well, yeah, I think when they come, yeah, I can't remember, but when they come in, there should be some hand sanitizers and maybe some masks there.
Yeah, definitely. And
somebody could watch it enough to see that people aren't just grabbing a handful of masks, but that would encourage people to wear them.
Yeah, and I mean, I'd be curious to how staff feel about people wearing masks. You know, like if, you know, some people are more comfortable with asking people to put on a mask than others, or, you know, like, because ultimately they're the ones that will be enforcing it if there is a actual policy to wear a mask. But that's my only other comment was.
I've got a couple things I want to ask, or one I want to ask. Have you thought about, and maybe, I don't know if I missed it or anything, immediately after this happened, we had a hold harmless. You know, if somebody felt like they contracted the COVID or the coronavirus at the library, you know what I mean? Is there any way that as people, and it's their first trip into the library, I know they did it at the athletic clubs as well, is, you know, having people sign a waiver? I don't know if we need that.
Yeah, Chris doesn't think we do because we have tort immunity, and he doesn't think it's going to be an issue. He thinks even without the tort, you know, does he think that that anybody could be sued? Yeah, but he thinks it would be beyond difficult to prove, but that we would have tort immunity protection. Now, if you're about to ask me to explain tort immunity protection, I can't do it.
No, I get it. I know what tort reform is.
Yeah, but he says it's not something he's concerned about.
Okay.
Okay.
I wanted to mention, yeah, we will have hand sanitizer, and do have hand sanitizer available all over the place. We'll have wipes for, but I forgot to put in this document that, you know, the services will be limited at first. I don't anticipate any library programs prior to August, and then it'll depend on some things, but or you know, meetings. What we are also sort of debating is, and we've taken out all the seating. There's no seating. We don't want it to be a come and stay library. We want it to be a grab and go library for this phase.
Yeah.
That said, there are people in our community that really need access to computers.
Yeah.
So we're trying to come up with a plan to, you know, give some fair and equitable access there without endangering anybody. So here are the issues. Easy enough to space people out, but that means we're using fewer computers. So does that mean we need to limit the use, limit the time, and or limit what you're using the computer for? And there's a lot of staff that feels passionately that we shouldn't do that. That sometimes, you know, logging into Facebook is pretty darn important. On the other hand, there are people that haven't been able to get into the IDS website to apply for their unemployment benefits or jobs. or finish the census. And you know, if we're going to have fewer computers, but maybe we need to make some tough decisions for a short period of time. Another issue that keeps coming up is, okay, we're supposed to keep our physical distance, but a significant portion of our patrons who use the computers need assistance. And that assistance is hard to give from 6 feet away. We are looking at the ability, if we could have the ability for remote access. So whoever is sitting at the computer desk might be able to, you know, get to that computer and assist somebody remotely. But those are the things that we're trying to figure out. I think we have to offer some kind of computer access as soon as possible.
Yeah.
How we're going to do that is something we still have to decide. I also want you guys to know that I've sent this to the health department, and I've sent this to the city of Decatur. I've gotten a verbal, you know, a sort of a agreement in principle from city manager that this is okay. But we both agreed that a paper trail is a good idea, so I've sent him a copy also, and still waiting for a response on that. But that's where we are. We're hoping that on June the 16th, we will be letting people in the building.
Okay.
Yep. Okay.
Yeah.
All right. Anything else on the opening date target? All right. So we'll move to the sick leave policies. There is a request for an action.
Yeah, and this is, I don't have an answer here. So what we have is built in to our union contract and to our management sick leave policy. We have built in some incentives to not call it sick. There are rewards for not using all your sick time. Is the biggest part of it. I'm not sure that is the smartest thing right now. Where, you know, we want to encourage people, hey, if you've got a cough, stay home. You know, if you've got to say, on the one hand, stay home if you're sick, stay home if you're sick, stay home if you're sick. On the other hand, we're going to give you a reward if you're not. Or we're going to request medical documentation after you use so many hours per year. I don't know whether the best approach is to agree to spend these incentives and disincentives until we get them, so to speak, or to simply, the other possibility, Ngozi, go ahead. You may be muted. Ngozi, you're muted.
Oh, sorry. Okay. I was just going to say, is it possible for you to maybe add a clause in here that says, and this is just a brainstorm, during times of emergency, that the city librarian can adjust these guidelines as needed, or some clause that would allow for the flexibility, but not to be left in there in perpetuity, but just during times of emergency, which rather than saying coronavirus, allows you for any emergency for you to decide when it is an emergency and to be flexible with these.
Yeah, just so we've got the whole picture, I'm going to mention one more thing and then tell you what Chris Sedilla says, and let's talk about that because it's certainly a possibility. There was a 3-day stretch in March, I think it was. I've lost track, but the 3-day stretch in March where.
Oh, wait a minute, Rick.
Yes.
Is it me or I'm hearing somebody's background?
Yeah, what I'm going to do is I'm going to mute everybody, and then we'll kind of start fresh here. Hang on, and then. So just everyone's muted. Just keep in mind if you need to speak, you'll have to take that step of unmuting. So we're going to get back to this screen. So FMLA. So the U.S. government passed through some major bills in a very short period of time back in, I think it was March. And one of them was the FMLA leave expansion, an emergency paid sick leave policy due to COVID-19. So this is a policy developed by HR Source. HR Source is a sort of a contractual HR outfit out of Chicago that we have a contract with, and they provided us with this. I think it can basically be adopted wholesale with just simply, let's make it Decatur Public Library here, and there's a couple places where it says the organization, et cetera, et cetera. We could change that to Decatur Public Library, but it sort of spells out that the federal government has decided that you get more paid sick leave if it is COVID-19 related. I guess what I'm wondering is, does this, what the federal government has provided, sort of negate this? So do we need to take any action given the fact that there's already laws that say now on the books that say if you've got COVID related issues that there's more paid sick leave for you? I don't have an answer on this. I don't even have a suggestion. I'm not sure what to do. Now, Chris's opinion was that I don't have his email up, but basically that we should have a policy with a sunset date on it, that the sick policy is loosened up. The problem is there's a reward in there. So are we going to tell staff that because of COVID and because we want you to call off when you've got a cough, we're not going to give you that reward now? These were good policies for the situation we were in 3 years ago when we wrote them. They're not good policies now, and I don't know how to fix it. So I am open to suggestion and brainstorming.
Yeah, my suggestion was the clause idea that you have the option to go with an alternative or more flexible, or you just use your discretion with how these particular guidelines are meted out. That was my suggestion.
And we would, if on the union contract, we'd have to negotiate that, and they would have to be okay with it. It would have to be an addendum. As far as management, yeah, we can do that. We can do that fairly quickly and easily. But I guess I'm not sure what that would look like, what that discretion that I would use would look like.
Yeah, I mean, that's why I said in times of emergency, because you won't know none of us would have known what coronavirus was going to look like. So there's no way for you to really know what kind of future emergencies we might have. 3 months ago, we would not have imagined what we've been through with coronavirus. So God forbid, we don't know what's down the pike. So it is purposefully allowing for that kind of flexibility.
And that makes sense to me. And I think the only thing that I would probably change is that, really loosening up on the requirement for medical documentation. Because we're telling you, we're hearing also, as if you've got COVID symptoms, we're hearing call first, don't just come in, and maybe they tell you we don't want you to come in. So how do I tell the staff that I need to have that? That's probably the only thing I would change. I think that's the biggest disincentive.
I mean, I would agree. I have never once, since I've been at Milliken, ever had to turn in any documentation to prove I was sick. And that's a privilege thing there for me. I realize it. And so if you can cut that layer out and put trust in your staff, then yeah, if you're okay with that I would. Yeah, no, and we have it's specifically triggered right now. There's some things that specifically trigger that you have to provide that documentation, and that would be something that I think probably under, for instance, and you're right, other things can happen, but under this current pandemic, I think is not helpful anymore. So I would be happy by the time we had full board meeting to work with Chris to write up such a clause and to work with the union between now and then to make sure that they're okay with it as well.
That sounds good. Were you also wanting us to make that action of adopting the FMLA like in full? I think it's a good idea. It's not 100% necessary. It's the law anyway, but I think it's a good way to sort of make it easily digestible and accessible by staff. But it's not 100% necessary. What do you guys think about that? Like, do you want to make a motion to adopt that and send it to the full board?
I'm open to either.
Yeah, I would say that, yes.
Okay, so I will take a motion then from someone.
I'll make the motion.
And so it will also include the clause to the sick leave policy, correct?
That might have to be separate, Samantha, because one of them will have to be an addendum to the union contract, so that might have to be separate. I think it will have to be separate. And but I don't know whether you want to vote on that now or just wait till just give me the direction to bring it to the full meeting. But
why don't we do that?
Yeah, I agree.
Okay.
Okay.
So did I have a motion to adopt the HR policy for FMLA?
Is that what you're, Rick?
Yeah, that I think we can do safely today. It's just that the language about suspending some other parts of the sick policy, I think is going to have to wait until at least till we meet with the union. But it has to be a separate document.
Well, if you have to make changes to it.
I don't have it. You guys just suggested it today. Oh, you mean the FMLA piece or the? I'm sorry.
Yeah.
Only I replaced this with Decatur Public Library, and where it says organization, change it to Decatur Public Library. That's it. Other than that, the language is terrific the way it is.
Okay. The one that you sent.
As far
us
as
here.
the clause that Ngozi suggested, that, you know, that will have to be a second document.
Oh, okay. Okay. What is it that we need to do right now? Samantha, what are you saying?
The motion on the table, as I recall it, was the FMLA, adopting that, and Samantha asked if we wanted to add in that clause with it, and I'm saying, all I'm saying is you can't add in the clause to that.
You cannot add the clause to it.
No, that's got to be a separate piece, which doesn't even need to be voted on today. So you had made the motion to accept the FMLA document, and that my recommendation would just be to go forward with that, and then I'll bring to the full board the language that amend the sick policies.
Okay. So we're going to make the motion to adopt the FMLA leave expansion, correct?
Yep.
Okay, I'm making that motion.
All right. Ngozi went to, is Ngozi back?
No. Ngozi, are you muted again?
Sorry, I also have a tiny human here. She had to run out for a second, but hopefully she'll be right
Okay.
back.
You second that, Amanda or Samantha?
Yeah, she said that at 5:30, so hopefully she'll be back.
No. You second the motion.
Can I?
Yeah.
Yeah, I'll second it.
I didn't know if you wanted Ngozi to second, or we just
I
need a
think I
second on-
can. I think I can, since it's just the three of us, right? Rick?
You know, we've never, Robert's Rules of Order, strict parliamentary procedure would say that the chair cannot second a motion, but we've never been strict about that. Our bylaws say we follow Robert's Rules of Order where, this isn't the exact words, but where it makes sense.
Okay, well, am I the chair of this, or is Samantha the chair?
I think I'm
You're the official chair, but she seems to be chairing this particular meeting. You're the chair of the committee, but she seems to be the chair of the meeting.
Mm-hmm. Well, the only reason I'm asking is, well, we're gonna have to table it until.
Oh, she's back. She's back.
Okay, Ngozi,
Yes.
I'm making a motion that we accept or we adopt the FMLA leave expansion and emergency paid sick leave policy
Oh,
due to COVID.
All right, all in favor?
Aye.
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 And I will bring language to the full board meeting about suspending the sick policies under medical emergencies.
Okay.
Vote on them at that time.
All right, so next we have a travel policy.
So I sent you guys, where did it go? I sent you something from the city, and then I kind of cut out what I thought could be made a policy. I could tell you that Chris liked it, Chris Sedilla. Let's see. So the city of Decatur, form of an advisory, a letter to staff. I took out the part that I thought we could turn it. Chris liked it as a temporary policy. And we can put, the only thing we'll have to do is we'll have to put, if you guys like it, is put some language about, okay, when does it end? When does it sunset? Such as phase 5 of Restore Illinois or something like that. But it's basically saying to staff, if you travel outside the local area, you got to follow these rules, that we're all supposed to be following anyway. It's your responsibility to disclose to your boss, and I'm going to change this to a library admin. During your travel, you come in close contact with a confirmed or presumptive case. Fail to follow social distancing or fail to follow any CDC guidelines for either your state or the destination location. In the event you're prepared to return to work but begin to experience symptoms, you will be required to self-quarantine for a period of 14 days. Library reserves the right to require employees to self-quarantine at home if we become aware of an employee's travel location with a disproportionate number of COVID-19 cases, or if the employee is exhibiting symptoms. And
Can I take a motion to accept the policy as provided?
We would need one thing, one more decision from the committee, Samantha, and that's if we're calling it a temporary policy, when do we sunset it?
So my suggestion would be the phase 5, I would say. I don't know if anybody else has a suggestion.
That sounds good to me. I don't know how you can put a date on it without.
Okay, so
Does that sound reasonable?
Right, yeah, I think it does.
I do too. I mean, I think it sounds reasonable.
yeah, I'm certainly okay with it. So
All right, so I will take that motion with the adjustments.
With the addition that it would be sunsetted, or
Right.
however you want to, at phase 5. Okay, I'll second that.
All right. Mangazi, can you hear us or?
Can.
Okay, so can you second Michael's motion?
Oh, I thought he seconded and I maybe I had missed it on.
Did you make the initial? Sorry.
No, that's fine. That's fine. You can use me as the primary, and then Ngazi can second.
Okay, then all in favor?
Aye.
Aye.
Aye. All right, so the next one is the board bylaws, and from what I understand, Rick wanted us to adopt this policy. Chris has basically wholesale, unless anything's changed. Is that right?
yeah, Chris Sedilla wrote this, and he would like you guys to pass if you want to continue to have. You were allowed to adopt rules for electronic participation prior to the governor suspending certain parts of the Open Meetings Act. And his recommendation is that we pass this resolution that we will follow these rules. So this is the action for you guys today, if you agree with it, is to recommend it to the full board, and they could pass at 2 weeks from today. So this is just rules for how going forward you could participate electronically. Otherwise, you don't have an option for electronic attendance.
Well, we do have certain of our board members that are unable to join meetings, especially in the certain circumstances of COVID, that are not able to join in person. So I think this is very useful. So can I have a recommendation to send this to the full board to adopt?
I recommend that you send it to the full board for adoption.
Second.
All in favor?
Aye.
All right. Okay, so next we have the meeting room policy.
And this is simply, it's time to review it. And I think it's a good policy. I don't have any problems with it, but I am going to make the recommendation I make every few years. And I think now it's a really good time to do that, even though we're not going to be renting the meeting rooms out at all for a while. I'd like in like this committee to consider recommending to the full board that for not-for-profit and community organizations that there be no charge for them to use the room. We're looking at annual revenue for meeting room use, which we're going to lose a lot of this year anyway. Annual revenue is about $8,000. So that's $8,000 out of nearly about $3.9 million dollars. I think it's a good gesture for the community, and these are organizations that are going to be hurting, and I know businesses are too, but these are community organizations that serve a terrific purpose, and they like coming here. They like to have meetings here, and in some cases, that $50 fee is prohibitive. So I like the policy otherwise, but right now the policy is if we partner on the planning or promotion of the library and the organization partners together, we don't charge you for the use because we're working together on it. We're partners. But I think we should go beyond that. I think we want these organizations here, and we want them here as much as possible. And this is their library. And right now, here's our fee schedule. So we charge $100 for the Madden for 4 hours, $60 for the daily, et cetera, et cetera. But we do, for government and nonprofit organizations, offer a discount. I'm just asking and recommending that we take the next step, and rather than the 50% discount, it's free for these organizations.
I would agree with that. Does anybody have any disagreements or agreements?
Otherwise, the fees are in place, correct? Other than for these organizations?
Yeah, these are the ones you're looking at right now. Can you see? I'm sorry. Can you see the screen?
Yes.
Yeah, I just have the policy.
Okay, so I'll send it to you. The fee schedule is $100 for 4 hours, and that's if you're in there for 30 minutes, we charge you for 4 hours. $200 for 8 hours in the Madden. 60 and 120 for the Staley, 40 and 80 for the boardroom, 60 and 120 for the children's auditorium. I can tell you it's the cheapest in town, and other organizations will, they're like, okay, it's $200 for our room. Oh, you wanted a podium? That's going to be extra. Oh, microphone? That's extra. They charge for every amenity. We don't do that, and we currently give half price, so half of those rates to government and not-for-profit organizations. And my recommendation is we leave it the same for commercial entities, but we discount, we completely do away with the fees for the, and we already would for certain government entities. City of Decatur, they own the building. We're not going to charge them. But I think that if, Kono, YMCA, any not-for-profit or community organization that wants to use our room, follow the policies that are laid out in this document. I'd like to have them here, and I prefer that we don't charge them. But that's my recommendation. I think it's a good gesture, and I think especially now it's a good gesture.
I agree.
All right, I will take a motion.
So do we need, is this another one of those full board, or are we just
Yeah,
plain old?
it needs to go to the full board. And so the language we would change is that we would change this language. The library will offer discounted rates, rental rates. We'll change that to the library will not charge rates for not-for-profit, community, or government organizations.
Gotcha. Okay, I move that we accept the statement of policy for use of meeting rooms to go to the full board.
Second.
All in favor?
Aye.
Aye.
All right, is there any new business? Any other new business? All right, I'm gonna send you guys an email since I have a friend here. So can I get a motion to adjourn?
So moved.
All right, so the ending time is 5:47.